Services Department. Today I'm going to introduce the leadership from Memorial Medical Center. They're going to provide a brief overview of the services provided at Memorial Medical Center. The volume of services and the number of collaborative partnerships is such that we're not going to even scratch the surface today. So the presentation today, again, is just kind of an introduction overview. We will be scheduling tours so everyone can go to the hospital and learn more about some of the specific programs. And I will be sharing information from the monthly board meetings with you all. So again, this is just the beginning of the conversation and a way to provide you all with a general overview because we have not done this in several years. So today, speaking on behalf of Memorial Medical Center, we have the CEO, John Harris, and the COO, Mary Armijo. So I will let them come up and begin the presentation. And this should be your up and down arrow.
Okay.
All right.
Mm-hmm.
Yep, so just down to, there you go.
Thank you so much. Good morning, Commissioner Chair, Commissioners. It's great to be in front of you this morning. I thank you all for having us today to talk about Memorial Medical Center and some of the updates that we have for you today and to address some of the concerns that have been raised about the hospital. I think most of you know me. I'm John Harris. I am the CEO of Memorial Medical Center. I have been so for the last 10 years. Joining me today are other members of our leadership team. First of all, I'd like to introduce our Chief Financial Officer, L.T. Thomas. And then additionally, our Chief Operating Officer, Mary Armijo. Dave Schmidt is our Chief Nursing Officer. And I want to repeat again how much we appreciate the opportunity to come before you and to address any questions or concerns that you have about our hospital and its operations. Okay, first I want to talk about our mission, our vision, and core values of Memorial Medical Center. Our mission is to make communities healthier. Our vision is we want to create impact on our community. We are one of the largest employers, taxpayers, and healthcare providers in southern New Mexico and more locally in Mesilla Valley region. We're proud of our record in Las Cruces and Doña Ana County. For 2 decades, as part of LifePoint, the Memorial Medical team has collaborated with both the city and the county to expand healthcare services across our region, to bring new providers to our community, care for all who live here, and to be a great partner. As many of you know, each year, our hospital publishes a community benefits report that outlines the many ways we are advancing our mission, and I want to share a few of the highlights with you from 2023. As you can see on this slide, we have 1,400 employees. Our payroll is more than $130 million. We've added 150 physicians and advanced practice providers. We provided $8 million in capital improvements, $54 million in charity care, uninsured discounts, and uncompensated care. And we paid $18 million in taxes. We had $1.7 million in community benefits programs. We have many
in the state of New Mexico, expanded Medicaid has made it rare that we are unable to help uninsured individuals in qualifying for coverage or financial assistance, which is a blessing. In most cases, our team is able to assist uninsured individuals in qualifying for Medicaid. And if they do not meet Medicaid's requirements, our hospital participates in the New Mexico Insurance Pool, which is a plan available to undocumented citizens or other individuals that don't meet Medicaid requirements. For the few people that do not qualify for Medicaid or the New Mexico Medicaid medical insurance pool, those candidates may qualify for the county's healthcare assistance program or the CHAP program. Again, this is very rare, and we currently only have 33 persons on this plan. Our cost to charge ratio that was mentioned earlier is similar to other healthcare institutions in the U.S. It is important to note that the cost borne by our patients is not based on facility charges. Rather, it is determined by their insurance provider who contracts directly with our hospital. And our hospital is in network with most insurance plans. In the case that we may not be in network with an insurance plan, we do offer single case agreements where we advocate for the patient on their behalf to set up a contract with that out-of-network provider. We understand that navigating healthcare, we do understand that navigating healthcare coverage can be increasingly confusing and complex. And we're highly regulated industry. Thank you. Thank you so much. I'm very dedicated to the speech. With the strict requirements that we have to follow often means that healthcare providers are restricted in the levels and kinds of support that we provide. That said, our team is always working on additional tools and resources to help patients better understand.
Does that conclude the
That
presentation?
concludes our presentation, yes, sir.
Wonderful, thank you. Commissioners,
Mr. Chair,
yes, Commissioner Chaparro.
thank you. Thank you for the presentation, Memorial Medical Center. And Mr. Chair, I would like to suggest that this become a work session because I think we need to have members of the community be able to attend not just a commission meeting, but moving forward to solutions and thoughts from the community instead of just making it a short presentation where we're just taking half an hour, including the public that would like to comment or share. And truly, you know, we hear things in the newspaper, we hear things on television, and as a former judge, I always think there's three sides to every story. And so I'd like to get down to the third side of this story and really delve into details and experiences that people have had at Memorial Medical Center. And I just don't think an hour would be sufficient. And maybe moving the work session to a little later in the afternoon so that people that are working can join us 4-ish or 5-ish to share their thoughts with us. Thank you, Mr. Chair.
Wonderful, thank you. And we can definitely look at doing that. We can have Mr. Lopez help schedule that as well. But while we're here and we do have a captive audience, if there's any questions that need to be asked of MMC, now would be the time. Commissioners?
Mr. Chairman,
Yes.
I appreciate Mr. Mijo